In the name of Almighty Allah, so today we will discuss World Immunization Week, which is celebrated from 24 April till 30 April 2024. So first of all, what is EPI? EPI stands for Extended Program on Immunization, and the basic objective of this program is to make vaccines available to all children throughout the world. So first I will give you an overview of EPI. EPI was launched in 1974 by World Health Organization to protect children by immunizing them against diseases. So EPI basic objective to cover six diseases, and the first one is tuberculosis, poliomyelitis, diphtheria, pertussis, which is also called whooping cough, measles, and tetanus, along with hepatitis B and also their mothers against tetanus. So the program has significant progress during the period of time in the term of immunization coverage and disease reduction. And the objective of EPI is to save children and mothers. So EPI is a life-saving vaccines program throughout the world, which is funded by World Health Organization, and this program was started in 1974. So in 2024, 50 years of this program are celebrated currently right now. So the objective of EPI is reduction of mortality and morbidity. So mortality related to deaths and morbidity related to diseases resulting from the EPI target by immunizing children of the age uh, from infant to 11 months, or from their first to 11 months, and women of childbearing age. 90% routine immunization coverage of all EPI antigens, with at least 80% coverage in every district by 2012. Next one, eradication of polio virus transmission by 2010. So in the whole world, polio are currently exist in just two countries. One is Afghanistan and the second one is Pakistan. Next one, elimination of neonatal tetanus by 2015, reduction of measles by 90% by 2010 as compared to 2000 time period. Next one, reduction of diphtheria, pertussis, and children. TB stands for tuberculosis to a minimum level, and to reduce the seroprevalence of hepatitis B virus to less than 1%, along with control of other diseases by introducing new vaccines for novel diseases, just like in the recent years, just like COVID-19. Next, now we will discuss the basic targets of EPI. So EPI program target is to immunize children of 0 to 11 months against EPI diseases, which I discussed earlier, sex diseases, and pregnant women against neonatal tetanus. Yearly target is around 5.5 million children having age bracket from 0 to 11 months, and 6 million pregnant women. And now we will discuss the schedule of EPI. So first of all, BCG. BCG stands for Bacillus calmette-guerin, and OPV. OPV stands for oral polio vaccine. Here is a mistake. So 0 dose are given at birth and no booster dose is required. Next, DPT. So D stands for diphtheria, P for whooping cough or pertussis, and T for tetanus, hepatitis B, and OPV at 6, 10 and 14 weeks. And measles vaccine will be given at the age of 9 months. Now along with Haemophilus influenza type B vaccine are used at 4 and 6 months of age. MMR vaccine, M stand for measles, mumps and rubella vaccine, is given to infant before the age of 1 year, and second dose at 6 months later. And the pregnant women and childbearing age ladies are provided immunization against tetanus. So now the whole schedule is TT1 at first contact, TT2 at least 4 weeks after first dose, and the next dose will be at 6 months after the second dose. The fourth dose will be after 1 year after third dose, and the last dose, which is TT5, at least 1 year after 4 dose. Now we will discuss the kinds or types of polio vaccine. So basically there are two types. One is IPV, inactivated injectable polio virus, which was developed by Dr. Jonas Salk, and the second one is OPV, Lyo attenuated oral polio vaccine, which was developed by Dr. Albert Sabin in 1961, and both vaccines are effective against all types of polio viruses. Now OPV is less expensive in comparison to IPV, and World Health Organization or simply WHO recommends 4 doses of OPV, while IPV are administered at the following schedule. So now IPV first, second and third doses are given respectively at second, fourth, 6 to 18 months, and the last dose at 4 to 6 years of age. Now procedure for the administration of vaccine. So first of all, just like on every medicine, there has been written shake well before use. So shake while is basically a small impule. uh, Shake while vigorously before withdrawal and use. Vaccine should be administered shortly after withdrawal from the vial, and do not use if resuspension does not occur with vigorous shaking. If there is some problem, so don't use that vaccines. Now we will discuss adverse effects, just like it common with all medicine, all antibiotics, all painkillers. So vaccine have adverse effects too, and the first one is swelling at the injection site, redness or local pain, along with fever also developed mostly in infants and children's. Now, we will discuss the basic principles which should be considered in immunization. So, first of all EPI antigen should be safe and effective. The next point is the recommended interval should be considered between two doses. Now, in which time period we should contraindicate vaccines. So, first of all, contraindications to vaccines. So there are basically two types. One is absolute, as already has mentioned, and the second one is temporary. Now we will discuss strategy for the vaccine delivery. So vaccine should be delivered in a proper conducive environment. So vaccine should always be stored in a cold chain, because there is a chance of denaturing. So first of all, uh, what is cold chain? So it is basically on next page. Now we will discuss missed opportunity of vaccine. So there are ample reason behind the missed opportunity of vaccine. So first of all, there is likelihood, if there is shortage of health workers, just like in Pakistan, there are attacks from Taliban side or from terrorist organization on polio workers. So most of the time delays occurs. Now logistical problem, because in far flung areas of Pakistan along with Afghanistan, So the delivery of vaccine and transport or accessibility is quite difficult. So that's why missed opportunity most of the time occurs, just like in African nations or other Islamic countries, because there is resistance to vaccination, and the most common among them is to polio. Now we will discuss about the storage of vaccine. So vaccine should be stored properly from 2 to 8 degrees centigrade. It should be kept in mind that vaccine should not be frozen or exposed to sunlight, because in both cases the efficacy potency of the vaccine become lost. Along with most of the vaccine we can store up to maximum 3 months. Some vaccine should be stored from -20 to -30 degrees centigrade, just like OPV, MMR, BCG, and measles. Some vaccines should be stored between 2 to 8 degrees centigrade, include DPT, DT, TT, HIV, and hepatitis B. And the last point is, as I have discussed about cool chain. So what is the cold chain? It is the system of storage and transportation of vaccines at low temperature from the manufacturer till it is consumed. In medicine we call it a shelf life. So what is shelf life? um, the medicine from the time of manufacturing till to end consumer, or till to the time of expiry. So this whole process is called shelf life. So now we will discuss components of cold chain. So in cold chain there should be equipment and tools, a health stop, and should be kept proper procedures and protocols and SOPs in mind. So refrigerator equipment include cold boxes, vaccine carriers, ice packs, which I have personally observed in BHO's hospital. Along with polio workers, there should be cold boxes along with. So all these are the protocols. Now tools for manufacturing the cold chain. So there should be cold chain monitor called freeze watch indicators, cold chain refrigeration graph, vaccine vial monitor, and shake test. Now, what are the factors causing damage to vaccine? So if there is any defect in cold chain, if there is problem of expiry, so all these points should be kept in mind. And now responsibilities of the federal and provincial governments. So in respective governments, it's the responsibility of all the government, just like planning, policy making, strategies, guidance, support, coordination with other law enforcement agencies or with other allied health agencies. So all these protocols and tools should be kept in mind in order to fully implement the EPI program. So in a nutshell, EPI is a best program for the saving of children. Now I will discuss some data about EPI. So EPI is basically recommended vaccine for the life. It is basically a live course, and there are different vaccine. Maximum number of vaccines are administered, but 13 are most are vital important. Now 4 million more children were vaccinated globally in 2022 in comparison to 2021. So this shows that there is a sharp spike in immunization process, in vaccination process, because people are getting aware on daily basis, because vaccine have ample benefits for the children, and there is a sharp decline in morbidity and mortality rates. So that's why people are by choice are now wishing that their babies should be administered vaccine even in third world countries. And still 20 million children who missed out one or more of their vaccine. So being a pharmacist, being a health professional, I strongly recommend vaccines, because Vaccines are life-saving drugs because they're helping in the boosting of our immunity. And WHO, which is a, a universal or global organization, and they are working with all governments across the world that they keep their children safe and healthy. So best of luck. And in Pakistan, along with other countries of the world, from 24th April till the end of this month, so there is a need of maximum awareness, guidance about vaccinations, about the storage of vaccines, and about the benefits of vaccinations. So thank you and best luck. If you people have any problems, so contact us and stick to Dawn Times for more videos and updates. May the God watch over you.